My name is Dr. Neil Holden. I'm a senior lecturer in the School of Life Sciences, and I'm an expert in viruses and respiratory diseases.
How does the vaccine work, and why does it require more than one dose?
The way that this vaccine actually works is it introduces a little bit of the virus into your system. It's a little protein from the virus. It doesn't contain the virus itself, it just contains a protein. Now what you need to do is train your immune system to actually recognize that protein, and that's why we have a bit of a waiting period between the first vaccine and the second vaccine. So basically what we're doing is we're introducing that protein into your system, your immune system starts to recognize it, and then we're giving your immune system a little bit of a reminder with that second vaccine, and that helps boost the memory of the immune system so that if you encounter the virus, your immune system is primed to help fight that virus and get rid of it before it starts causing any symptoms.
I just wanted to know, what does the 6-month booster do after your second jab?
I think a lot of people worry about, these booster jabs and things like that. What you've got to remember is that what vaccines are really doing is they're training your immune system to recognize the virus and to really prime your immune system that if you do encounter the virus, it's there and ready to fight the virus and stop it before it actually gives you the disease. So what we need to do is really train your immune system. Unfortunately, with this particular coronavirus, your immune system isn't very good at remembering it. So you have the vaccine and it gets your immune system ready, but it kind of over time starts to forget about what that coronavirus looks like. So the booster basically gives your immune system a bit of a memory boost and reminds it what it's looking for and what it needs to protect you. So that vaccine boost will raise your antibody levels, it will activate those immune cells, and so that if you do encounter the virus, it's there, it's primed, and it's going to help prevent you either catching the disease, or if you do catch the disease, it's going to really lower the severity of that disease.
Hi, I'm Emma, a third-year law student. How worried should I still be about COVID if I've already had both the vaccines?
So this is a question that comes up quite a lot, Emma, in terms of how protective the vaccines are. We know that they're not 100% effective. They don't block all disease. We know that you can still catch coronavirus even if you've had both vaccines. However, the really good news is that the disease seems a lot less severe in people that have had both vaccines. It's also more difficult for the virus to spread from people that have had both vaccines. Now, it's not impossible. That's why we still need to keep up with some of those other precautions, such as wearing masks, washing our hands, keeping distance, etc. So if you've had vaccines, that's that extra layer of protection that's going to help prevent the spread of the disease, but also help prevent the severity of the disease if you are unlucky and do catch it.
How much does having both vaccines reduce the severity of COVID?
That is one of the major things, Rachel, that's most important about the vaccines. They do help reduce the spread, but the really important thing is they're reducing the severity of the disease. So if you have a breakthrough case of the virus and you still you do catch the virus despite being double vaccinated, certainly all the evidence there is that the severity is massively reduced. So we're seeing far less people who have had the double vaccine in hospital. Certainly, it's helping those people that are really vulnerable, that have underlying health conditions, and we're seeing much lower severities of disease in those patients as well. So having the double vaccine definitely lowers the severity of the disease and is really helping to save lives.